Good day and welcome to the Visioning for Prevention, Leading the Charge for Transformation conference call.
I will now turn it over to our moderator today, Nicole Barnes.
Great, thank you, Chris. I just want to do some quick introductions today. I am the Capacity Building Center for States Constituency Services Manager, and I will be moderating today's conversation and presentation. I'm joined by our fellow esteemed colleagues from North Carolina. We've got Kathy Stone, who is the Safety and Prevention Section Chief for DHHS there. We've got Deborah Day, who is the Community Prevention Program Administrator with North Carolina DHHS. Triple P Family Partner representation from Barbara Young. And from the Duke Endowment, we have Philip Redmond. Next slide, please, Chris. Today, after we review the objectives and do those introductions, we're going to hear a little bit from the Triple P team, just a little bit about what the Triple P program is, and really hear from them about how a program like this aligns with FFPSA prevention plan goals. And then we're going to talk a little bit together, collectively, stories from the field about how agencies, partners, and families can work together to really transform systems towards a prevention orientation. And then we'll do a quick closing and introduce you to one of our brand new resources that's just been posted on our website around the prevention continuum. Next slide, please, Chris. So our objectives today, we really want all of our participants to just gain some awareness of how these programs and practices can align with our Family First Prevention Services Act prevention plan development. Really help you identify those partnerships and the relationships that agencies need to develop, and then to implement those prevention-focused interventions through an FFPSA prevention plan. And then really, we hope that today, after our conversation, that you'll be inspired to really see that value into leaning into risk and uncertainty to achieve transformational change. This work is not easy. It's hard. It's sometimes challenging, but we need to force through and keep pushing so that at the end of the day, we can see the light at the end of the tunnel. So next slide, Chris. So now I'm going to turn things over to Barbara Young, who is with the Triple P program in North Carolina. Barbara, take it away.
Thank you for having me. So I'll tell you a little bit about Triple P. The model was designed by Professor Matt Sanders at the University of Queensland in Australia over 35 years ago, and it continues to be evaluated and tested to this day. What started as an approach for families in need of intensive support has progressed to a public health model with population-level approach. It's designed to support the needs of every parent and caregiver. It's designed for parents of children birth to age 16, and it assists families with a wide range of needs, including normal developmental concerns, as well as internalizing and externalizing disorders and developmental delays. And then also it works in special situations like separation, divorce, or overweight children. Next slide, please. And that goes with what I just said. So it really is tailored to support every family. And it improves parenting skills and confidence as well. Next slide, please. The Triple P pyramid shows how strategies increase in intensity as you move from the bottom to the top of the pyramid. Level 1 is like flyers and billboards. Level 2 is going to be like a one-time encounter offering a tip sheet about child development, like maybe separation anxiety, or for a specific behavior like disobedience. Level 3 is going to be 4 sessions with a practitioner around a specific issue, going more in depth than a level 2 encounter. And then level 4 is going to be more in depth. It's going to be 10 sessions with a practitioner, usually a mental health provider. And level 5 is going to be intensive support for families with complex needs. Next slide, please. Triple P's principles, or their goals for parents, include creating a safe environment, or a safe, interesting environment. I like to think of this as physical space. Children need a safe environment that provides interesting and plenty of opportunities to explore, discover, and develop their skills. And they need that environment to grow. And it also provides an opportunity for parents to be more relaxed about their parenting because the risk of being hurt is minimized when the environment is safe and interesting. Having a positive learning environment is a supportive, nurturing environment in which children learn and develop their skills. Think of nurturing space. When children need help, care, or attention, parents are available to meet the needs of their children. Assertive discipline involves being consistent, acting quickly when children misbehave, and teaching them to behave in an appropriate way. It also means staying calm and using fair, predictable consequences that match the problem behavior. Parents' expectations of their children depend on what they consider normal for children at different ages and stages. And children are individuals and develop it at different rates. And sometimes parents don't know what's realistic. So Triple P helps lay that out for them, showing kind of what's developmentally appropriate. And last is taking care of yourself as a parent, because we know, everyone knows, that parenting is easier when a parent's personal needs for support, companionship, recreation, time alone are being met. And of course, being a good parent doesn't mean that your child completely dominates your life. Remember, parents have we have our own needs as parents, and it's important that those are being met, and when they are, it's much easier to be patient, consistent, and available for your child. Next slide, please. Using the Triple P strategy pyramid, practitioners introduce 17 different strategies using tip sheets, which parents get to keep for reference, allowing parents to pick and choose the strategies that best fit their family. When working with a family, I always suggest that parents choose one strategy from each level, right? Preventing the behavior, encouraging the right behavior, and then managing the misbehavior. When we focus on these strategies, we achieve the desired outcomes of preventing behavioral, emotional, and developmental problems in children. It enhances their parents' knowledge, skills, and confidence by using coaching and role plays and providing positive feedback. It also builds upon parents' strengths and abilities to be self-sufficient and self-reflective, asking questions like, what went well? What would you do differently? And we always lead with strengths, and by reducing the incidence of child maltreatment in our community. So as a level 3 practitioner and a family partner working within my local DSS office, I worked with a mom of a toddler who was reported because of supervision and safety issues. I was able to meet with her and share a tip sheet on wandering. And by reviewing that tip sheet together, we talked about how toddlers start to explore their environment once they can move, right? And how natural that is. And we explained that, it's common toddler behavior, so common actually, that Triple P created a tip sheet just on wandering. Then we reviewed the strategies, and Mom was able to create a parenting plan using 3 or 4 strategies that she could implement or put into place over the course of the week. We talked about possible scenarios. We did a role play. And then when asked when she could start using these strategies, she was excited and said right away. So the next time I met with her, we discussed what went well. What would you do differently? And then she even suggested that maybe she'd change something. So this is exactly what we're looking for. We're looking for parents to take control of the decision-making and creating the plan that is just for her. Next slide, please. And so we find when we work with families using Triple P and when we work with communities that embrace Triple P, children have improved behavior and social emotional skills, and we see better self-regulation and improved health. And parents experience decreased stress and anxiety and depression, as well as increased confidence in parenting. And you'll notice both children and parents have better child-parent relationships. There's more satisfaction there. They enjoy being together. And child welfare sees the decreased out-of-home placements, decreased child maltreatment cases, and decreased juvenile justice cases, and improves health. Now I'll hand it off to Phil from the Duke Endowment for a historical perspective.
Thank you, Barbara, very much for that introduction. As Barbara just said, Triple P is one of the most widely known parenting programs in the world. You know, as Barbara emphasized, it has extensive research showing that it can reduce incidences of child maltreatment, entries into foster care, and emergency room visits that are a result of abuse and neglect. And importantly, Triple P has growth targets that establish for you how much of a population in a given geography needs to be exposed to Triple P in order to achieve those population level outcomes. Those growth targets are a unique feature of Triple P, unlike any other evidence-based program or system that I am aware of. But equally importantly for North Carolina is that because we're taking a public health approach that is normalizing this idea of parenting support, we are empowering family choice. We're enabling parents, caregivers, foster parents, whomever, to ask for and get the assistance that they want and need in the amount that they determine, rather than being prescribed that you must attend X number of sessions or you must complete so many courses or what. So this idea of family choice and a public health approach are critically important to North Carolina. Next slide, please. The only thing I would add to this particular slide is that in 2014 and 15, the endowment funded an implementation evaluation of Triple P in 2 counties that were early adopters. That evaluation found that there was a need for more implementation support in order to build local capacity to ensure fidelity and sustainability. Hence, this combined effort of the endowment, the Division of Social Services, and the Division of Public Health to fund an implementation support system that is integral to this statewide expansion. And this support system is through Prevent Child Abuse North Carolina and the UNC Frank Porter Graham Institute's Impact Center, who are supporting the counties and the regions across the state to build their capacity to actually implement Triple P as it was intended to be done. Since 2014, the endowment's funded about $4.2 million along with DSS in implementation support to grow this model, and we're hopeful to approve an additional $3 million very soon to continue and to grow this implementation support system. So Triple P is really a big bet for the endowment, and we're excited about this partnership with our colleagues from the Divisions of Social Services, Public Health, as well as the number of others that are also involved in this effort. But let me stop there and turn it over to Kathy.
Thank you, Phil. You can go to the next slide, Chris. So when North Carolina started looking at the evidence-based programs we wanted to provide within our Family First Prevention Services plan, we really considered our priority would be the needs of our candidacy population. What were the things that brought those candidates into foster care and out-of-home placement, and then what could we provide to prevent that from happening? We looked at how the clearinghouse rated all of the plans. Were they well supported, or promising? We looked at what those services for children and parents really were and what they would provide. What already existed in North Carolina, and what was the implementation support in North Carolina. And of course, you know, as Phil just talked about, we already had some well done and well provided Triple P services there. We were also looking at the age range, and Triple P, you know, covers family or children from birth to age 18. So that was certainly one of the things we looked at. We also looked at what are Medicaid covered services so we could leverage our FFPSA money, and what would the evaluation requirements be, because we knew that bringing that aboard, we had to be able to show that the services we selected, would actually, help children and families. You can go to the next slide. So again, when we looked at how Triple P aligned with Family First, the clearinghouse rates it as promising, and so that allows us to bring that in as one of our evidence-based practices. The services for families with children, as I said, that's birth to age 18, so that was coverage for all of the children that we would be seeing as potential candidates. We have the existing infrastructure in North Carolina through our efforts with the Duke Endowment and Public Health. We could build on that. And we also had the implementation support with Prevent Child Abuse North Carolina and Frank Porter Graham that we could make sure that was already in place and in supporting as we implement Triple P. And we also saw that it was less intense than some of the other more clinical evidence-based practices, and so we thought it was more family-friendly and we would have an easier job of engaging parents with this, plan or this practice. Also, it promotes positive parenting behaviors and improves family functioning, and that we hope would prevent children from ever entering into the child welfare system if we can interact with those families earlier, and certainly can help children from penetrating further into child welfare and losing being in the home with their birth family. Next slide, please. And so North Carolina has our Child and Family Services Plan, and in part of that plan is the strategy. By that 2024, North Carolina is going to have a comprehensive framework to strengthen families and prevent child maltreatment. We know that that is going to be, Family First is going to be a part of that, but other services will need to be woven into this framework. So how will Triple P help us with that? It's already accessible in all 100 counties in North Carolina. We have a structure for providing Triple P already, and we have trained Triple P practitioners. We know it has quality, it's evidence-based. We have the implementation support and data collection in place already. And that there's affordability, and we can expand this model. It will be cost effective. And so now I'm going to turn it over to our moderator, Nicole.
Great. Thanks, Kathy. We are going to just spend the rest of our time today engaging in a discussion. And while I would love for Kathy and Deborah to be able to join us by webcam today, I think in the last year we've all learned the challenges and the benefits of moving to all things virtual. Unfortunately, their technology won't allow us to join by webcam today. But we're going to just engage in some conversation. So Deborah, we want to hear from you first, just about the relationships and partnerships that were needed to develop and implement the program. What were some of the challenges, and how did your team persevere?
Okay, thank you, Nicole. So I would say that this is a long process. So Phil touched on the historical background that we have in North Carolina. So in 2005, our Prevent Child Abuse organization, which is called Prevent Child Abuse North Carolina, convened a funders alliance, and that consisted of the Division of Social Services, the Division of Public Health, Division of Juvenile Justice on the state level, the Duke Endowment and Kate B. Reynolds Foundations, and also Blue Cross Blue Shield, who has a foundation as well. And the goal of this alliance was to talk about how, as a state, we could move our various funding mechanisms towards evidence-based programming. And we wanted to develop a shared vision and shared outcomes for prevention, and we wanted to try to align our requests for applications. And so this was a big shift. People were used to doing things their own ways, and evidence-based programming was kind of new on the horizon. So at the start, these discussions were rather difficult as participants kind of developed trust with one another, and we had to compromise on some of our bureaucratic procedures. So that took a long time to come together. And then the Division of Public Health decided they wanted to go in another direction. So we were all funding similar programs. We were funding Incredible Years, Strengthening Families programs, and the Division of Public Health decided that they were going to invest all of their MICV money, their maternal, infant, child, home visiting money, and also their Title V funds in PPP training and infrastructure. They wanted to create a system that used already existing practitioners, folks that are already embedded in public health or had a private practice, either primary health or mental health, worked in the schools, worked in early intervention, folks that already were embedded in the system, have them train in PPP and use that as one of their strategies, because PPP doesn't supplant other strategies. It's another tool. And so this was a risk for them to do something different. And it took a little while for the rest of us to decide to join them. So that is kind of some of the challenges that we started with. And Phil has been with us since the very beginning. He was part of this Funders Alliance. So I'm going to ask him if he could answer the question from his perspective as well.
Thank you, Deborah. And I'll just add on, I think the primary challenge for this work was that the Division of Public Health decided to move alone in this effort to grow PPP, which was a challenge, and they had their reasons for doing that. And hence, my personal view is there wasn't enough attention paid to the implementation support system that needed to be built to undergird this massive statewide effort that the division was undertaking. To their credit, to the Division of Public Health's credit, after data, there were some changes in leadership and so forth, they made a course correction and authentically invited others to the table to help them think about how could they really grow PPP in a way that would achieve those population-level outcomes that they desired. And I think that course correction is a strength of the divisions, and the willingness of all of the rest of the team, Division of Social Services, the endowment, others, Smart Start, for example, to come to the table as well and say, we want to help. How can we be supportive of you? So I think that's been the biggest challenge, is just getting us all back on the same page, moving together. But I do feel like we're in a much better spot now than we were 7 years ago, for example. But let me stop there.
That's great, Phil. What do you think were some of the drivers, or those, the greasing the wheel type things that really laid the foundation for the success?
For me, I think it really boils down to this concept of trust. The Division of Social Services, and I don't say this lightly, is probably our most important partner in our prevention and early intervention work, which is an unusual thing to say, I suspect, about most child welfare agencies, because most aren't as deep in early intervention prevention as North Carolina. And so, and the reason I say that is because we've had a number of years working together, getting out of our silos, jointly funding efforts, sharing decision-making, sharing outcome results, sharing authority and accountability for our work that really has built a trusting relationship between the endowment and the Division of Social Services in particular. And I think the driver of trust has resulted in our really good outcomes that we're seeing from some of our other funded work. For example, in Incredible Years and the Strengthening Families programs across North Carolina, we routinely get comments from the outcome monitors who are external to all of our organizations about the quality of the implementation support that is being provided by Prevent Child Abuse and others through funding from the division and the endowment are really producing incredible outcomes that often exceed, or at least meet and sometimes exceed, national norms. I think trust has been a real driver but let me stop you. I don't want to monopolize. Deborah, I don't know what your perspective might be.
So I just want to provide some really concrete examples on what Phil is saying. So at the Division of Social Service, we do fund some direct services, and there are a lot of them are family support, they're parent education, parent support, in-home visiting. And when we go ahead and write a request for application and we make funding decisions, we make sure that they're aligned with our entire system. And some of the examples are, we had one funding cycle where there was an agency providing Incredible Years that was involved in an Incredible Year pilot, and they scored too low to receive funding that particular year. And it was actually a 3-year grant buyout. So they didn't make the cut to receive funding. Duke Endowment, where Phil works, does not typically fund direct services. They're more interested in system-level work. And so we talked with them about how this might impact the pilot, and they decided to go ahead and fund this agency for 3 years of the cycle in order to protect the integrity of the study. And so that is something, again, we made a joint decision together. Another example is much more recent. Last year, when we all went home because of the COVID-19 pandemic, it really changed the way our evidence-based programs were delivered. So they were delivered virtually instead of in person. They focused on providing social support, providing concrete support. There was some parent education, but they were not following the curriculum the way it was intended to be in person because it just was a lower priority at that time. And so we have a really structured outcome evaluation that's funded by many different agencies, and we've been doing it for a long time. And those outcomes and their processes were no longer relevant. And yet we didn't want to have no evaluation. So social services, the Duke Endowment, North Carolina Partnership for Children, which is our Smart Start organization, they serve children 0 to 5, and they provide lots and lots of family support, direct services, and Prevent Child Abuse North Carolina, who provides implementation support and manages the evaluation for us with outside evaluators. We had several meetings where we discussed the requirements, and we ended up reaching a consensus that met everyone's needs about what was our evaluation going to look like for 2020 and also for 2021, because we realized we weren't going to be having any in-person services this year either. And so in particular, in this particular configuration, the North Carolina Partnership for Children and DSS are the funders of direct services. And so we had separate meetings where we wanted to align our requirements and our guidance for direct service providers. This is an uncharted territory. Excuse me. We didn't know what our agencies were going to be able to do, and we knew we wanted to minimize the burden and we wanted to minimize confusion. We didn't want them having to do one thing for us and another thing for another funder. And I will say in this particular instance, North Carolina Partnership compromised more to make this happen, because at social services we have stricter criteria for things that we couldn't necessarily bend. And they thought about it and they talked to their providers and they said, we can do this, we can come back. So all providers are doing exactly the same thing for this year and a half. And I just feel like that was really a beautiful example, but it wouldn't have happened if we hadn't been working together for the past 15 plus years.
That's a great story, Deborah. I want to hear a little bit, you told us a little bit about how this program really initiated in the public health arena, but what drew the DSS to Triple P as a strategy that could address some of the challenges you were seeing in child welfare?
So as I mentioned before, North Carolina Division of Social Services is really invested in evidence-based programming. And Triple P is definitely got the research behind it to prove that it is evidence-based. Most of our programming, however, is based on a social work model, and that focuses on individuals and families. And since the Division of Public Health had already established Triple P investments as a public health model designed to have population-level impact, we didn't want to create our own parallel system when we received funding from the General Assembly. We wanted to make sure we were partnering with other state agencies and philanthropic agencies and the community-based programs. Again, we wanted to maximize what was going on rather than trying to start something completely different. And as Phil said, public health had invited agencies, including social service, to the table to help them with Triple P. We had been doing that as a partner for a long time. And so when we had this funding, it just offered us an opportunity to combine our social work perspective with their public health model to impact the entire community, preventing children and their families from being involved in the child welfare system. Because that is our ultimate goal. You know, even as child welfare intervenes with families, we know that the best path to success is preventing them from having to come in contact with us, helping their children never having to experience child abuse and neglect. So it was just a really nice combination of a public health approach that was evidence-based with our social services approaches, which are also evidence-based.
Thanks so much for that, Deborah. That's really helpful. Kathy, I want to hear from you just a little bit about how North Carolina believes that the Triple P program is aligning with those core tenets of Family First and this goal of really transforming child welfare to a prevention orientation.
Well, I think that first of all, we looked at the population level evaluations of Triple P. They have a favorable impact on the same population targets as FFCSA. For instance, they demonstrate decreased out-of-home placements, decrease in child maltreatment cases and child maltreatment injuries, and that require an emergency room visit. So that certainly lines up exactly the way we want our services in FFPSA to be offered. Second, Triple P fits into our plan because it is flexible. It covers the different intensity needs of families from very low intensity to increasing intensity, and it's appropriate for all ages of children from birth to 18. And it supports services that are already in place or that we may add. It doesn't displace those services or other interventions, and it doesn't require a specific therapeutic skill. You do not have to be a licensed clinician in order to practice Triple P. And so it doesn't require such a large or ongoing investment. Triple P is also ideal for child welfare workers to be able to be trained in and then add that to their set of skills or their toolbox when they serve our clients.
That's great. Kathy, real briefly, can you just tell us how the agency is really supporting those county leaders to implement programs like Triple P?
Yes, North Carolina has established 10 Triple P local implementing agencies, or LIAs. You know, we like acronyms in child welfare. But those are located within local public health agencies, and they support the Triple P practitioners. The LIAs organize training for the practitioners. They can offer technical assistance when practitioners may be struggling or need some assistance. They do public awareness efforts, and then they also collect data for the state CQI system so we can prove that the system is working, that Triple P is working for children and families. And our trained child welfare workers are part of that system. They supply that data, and they also have all the access to the support from the LIA coordinators. Also, you know, our partners at the Public Health, at Prevent Child Abuse North Carolina, and the Duke Endowment, we fund the LIAs. We fund the research-based implementation support, the training, and we also have online Triple P codes. And in the time of COVID, those became really important so families could access those virtually. And in North Carolina, the Division of Social Services also funded a position to provide implementation support directly to our county child welfare agencies. And that's in the form of newsletters, learning collaboratives, and also site visits to help stand up Triple P in those local counties that wanted to participate. And I think probably the last thing I would say about supporting Triple P is that we have a VOCA grant to serve children in foster care and in group homes. And as a part of that, the division is going to train 180 child welfare workers in Triple P Level 4 to provide those services to children and families who are involved in the foster care system.
Thanks so much, Kathy. I hope that our participants can really see that connection there and how the state can support counties in this work too. I'd want to hear a little bit from Deborah just about this partner support story with the Duke Endowment and really even tell us a little bit about the background of it, but also what advice you'd give to participants who maybe are struggling to build that capacity to engage their private and philanthropic partners in this work.
Sure, Nicole. So again, we all came together and agreed instead of funding direct services, we're going to fund training and implementation support. And that has been critical because it allowed us to scale up Triple P to all 100 counties. We didn't necessarily have enough money to fund practitioners everywhere, but we were able to provide the support for those practitioners. And again, I'm going to tell a really quick story about how this all worked together. When we first received our money from the North Carolina General Assembly for Triple P, it was called non-recurring, which means we get it for 1 year. And so we were going to use it to purchase implementation support, but the University of North Carolina wasn't interested in doing something that was only going to be for a partial year, because they have to hire staff and train staff, and it just really was not a good investment of their time. So Duke Endowment had been supporting them, and that funding was going to expire and be used for something else. And we had this meeting where we just all laid our cards on the table, and Phil said, you know, we hadn't really planned on continuing this funding. And UNC said, we really cannot take the risk that this might not go forward for a second year. And so as we talked about it, Duke Endowment said, we don't want to lose this opportunity with the state money. And so they agreed to go ahead and commit to multiple years if necessary. That worked out really well for all of us because it enabled us to start the process, and then the next year the legislators did make it recurring. So it turned out we at Social Services were able to cover it. But otherwise, we would have all been at a halt, you know, a standstill. So it's, again, just one other example of how this partnership works. And I would say any advice is the same thing that Phil has said, that it's all about trust and relationship building and being willing to engage in difficult, honest conversations. Thanks, Nicole.
That's great, Deborah. Thank you so much for telling us that story. I think it really resonates with folks. Barbara, I want to transition just a little bit about to how Triple P benefits families involved in child welfare.
So I've found that with Triple P in a community everywhere, they find, you know, if they're seeing it at pediatricians' offices, at schools, you know, at community organizations, at child welfare, everyone's speaking the same language, and it minimizes the shame of asking for help, and it you know, it makes it easier for families to say, this is not a problem, right? Everybody has this problem. And so how do we teach those skills and utilize the strategies that they provide? And I think that's the other part that's so important, is that it's, you know, common strategies that people don't think about as being a strategy, but showing affection is a strategy that Triple P utilizes. And I think if we write it down like they do in a parenting plan, we say, which of these do you think you could do more of? And which of these do you think you'd like to try that's new? And when we do those things and we encourage families to look at that, right? You said you wanted to show more affection. How do you think you did on that this week? Do you think you did better? Do you think you could use more improvement there? Do you want to practice, right? And it gives families the chance to choose the strategies to reinforce the things they're doing right, because we want to build on the strengths, and that it also teaches the ability to kind of self-evaluate. How am I doing? What do I need to do differently? And how can I change that so that when behaviors change or when situations change, they can apply those same skills that they've learned through Triple P.
Barbara, one last question. In your role as peer support, how does the Triple P program really help you to engage and support families in these services?
So Triple P is all about common behaviors, common issues, right? I mean, it's worldwide, it's 35 countries, and we have a Triple P tip sheet on that. So really and truly, the poor family, the mom that her toddler wandered away, she's like, so that he was found in the yard outside. So, I mean, that's a scary thing for a parent. But to know that it's a common problem. So what can we put in place? What can you do to help make this easier, to make sure that it doesn't happen again, right? And how do we build on that? And I think the other important thing to remember is that 10 of the 17 strategies are all about building positive relationships with their children. And so with that, those are skills that you can use anytime, anywhere. And because of that, parent to parent, right, I've had that problem. My children have disappeared on me, right? I lost one in the center of a clothing aisle, right? He just up and under the clothes and gone. And so how do we, we let people know that it's not that it's okay, it's that it's a problem. And so how do we address that issue so that it doesn't happen again, so that it doesn't turn into a problem? And I think that with that, parents learn better from other parents. And, I can't imagine the time, well, the last time I had a pediatrician tell me, how to manage my child's behavior, I'm thinking, you don't even have kids. You're not hardly even old enough to, that you could be my child, I'm thinking. And so, I think parent to parent really says a lot. And this is exactly a great place for families truly to support other families. And I think, if you could utilize parent peer support, doing level 2 or level 3 Triple P in your communities, it's a great way to provide that support for families.
That's great, Barbara. Thank you so much. And I know we're just a little bit over, but we're just about finished here, folks. If you could hang on with us. Chris, if we could go to the next slide. This has just been such an awesome story from all of our presenters. We just wanted to real quickly let you know how you can connect with the center. You can sign up to receive messages from us through our Gov delivery system. And then lastly, feel free to contact us if you are looking for more information or have questions for any of our presenters. Feel free to contact us at capacityinfo@icf.com. And we hope that you'll take just a moment to fill out the evaluation survey that is also in that web links pod there at the top of your screen. I want to take just a moment to thank all of our presenters today. Thank you to the amazing team from North Carolina DHHS, as well as to Phil Redman, and of course our parent partner in Barbara. I hope that our participants have learned a lot about the value of really coming together and building those trusting relationships and partnerships so that we can create that holistic vision for a transformational system that really puts prevention first. So thank you so much, and without further ado, we will go ahead and close the call.